Coming up on the Doctor's Hospital podcast.
The way vaccinations work, it stimulates your immune system to recognize and fight pathogens without actually causing the disease, right? But back in the day, before we had vaccines, kids died from chickenpox.
Are you seeking exceptional healthcare beyond the traditional hospital setting? Introducing Doctor's Hospital Clinics, your trusted destination for comprehensive care. Our full-service locations provide affordable services through our Loyalty Advantage membership program and NHI. Experience seamless care with our integrated health system, where your medical history travels with you, ensuring continuity of care. Book an appointment today at clinics.doctorshosp.com. We make primary care easy.
Welcome to the Doctor's Hospital podcast. I am your host, Alexis Burrows, Marketing Director at Doctor's Hospital. I am joined here today as we kick off our Back to School podcast series with our returning guest, Dr. Teykia Deveaux, who is here to talk about physical health and safety as our kids, our students get ready to go back into school very shortly, it seems. I don't know where summer has come and gone to, but we are quickly approaching the end of summer and the beginning of the school year. So welcome back to the show, Dr. Deveaux. We're happy to have you on to go through this interesting and informative topic. So thank you for being here.
Alexis, thanks for having me back. I can't believe it's August.
I know.
It's wild.
The time just, I don't know where it goes. So what we want to talk through, I guess, three primary areas as we talk about physical health and safety, kids getting ready to go back into the school environment. So we want to talk about boosting immunity for the school year. We want to talk about, COVID-19 precautions and updates. It's been a couple of years now, but obviously we had a recent spike in COVID cases. So there's something you kind of want to, remind parents and students about, how they should operate and some precautions they should take. And then also talking about healthy eating habits, specifically as it pertains to, like what you put in the lunchbox, how you go about finding a balanced diet for kids who sometimes just seem to be willing to go off of macaroni and cheese or spaghetti and nothing else. So we wanted to talk to those high level areas. So we'll go through a few questions in those areas and kind of talk through that. So starting with boosting immunity, what are some essential vaccinations that children should have before the school year starts?
So that's really age dependent for pediatrics and school dependent as well as to what is required for the school. And obviously the Ministry of Health has a set schedule that they want most or if not all students enrolled in school to have. The common ones are going to be your diphtheria, tetanus, and pertussis, or your DTaP, your measles, mumps, and rubella, MMR, or your chickenpox. The fancy name is varicella. Polio, which would be your IPV. We have hepatitis A and B, influenza, meningococcal, and then HPV, which is optional, but it's really our only vaccination against cancer. So I really encourage parents to get that one as well for their adolescents.
Right, because I was about to ask what age is the HPV vaccine for?
Yeah, so we give the first dose at 11. If we give it to them before they turn 15, it's 2 doses. If it's after 15, then you have to get a total of 3 doses. But highly recommended. I know there was some initial, as with any vaccine, there was some initial hesitance with that. But like I said, I really recommend it for adolescents. And it's protective, as you get older as an adult. So.
And the MMR and the DTaP, those ones, the chickenpox, those are all, I guess, the early stages, right? Because I think that's the 6 months, a year, or 5 years. That's kind of the run of those because there's a couple of different doses for some of those, right?
Yeah. So the first 2 years is where you get, those 2, 4, 6 months. You see the pediatrician all the time for shots. But then right when they start kindergarten, we bring them back and give them another set of boosters so that they're all good to go. They kind of get a break from those multiple shots until they turn about 10 or 11 when we come again. And then around 16 or the time before they go to college, we boost them again.
Right.
Yeah.
It's interesting. So we just finished that run with my 1-year-old in terms of the 2, 4, 6, 12. And then obviously we would have done my 6-year-old last year would have done the 5-year vaccines. It's a very big difference between those first 3 or 4 and then when you jump to that 5-year one, because then it's like they're very aware of everything that's happening. And so now she's like, and when do I get stuck again? It's 10? And she's counting like, dude, you just got them last year. Just relax. But, it is interesting to watch that journey of when they get shots and their reactions to them. so funny because it's like in the early stages, they just cry for 30 seconds and then move on. But then when they have awareness, it's just like, oh my God, the shot's coming.
Well, there's that anxiety that is developed, right?
Hmm.
Probably around those 18-month shots, those 15-month
Hmm.
shots. And then at 4 or 5 year olds, you're telling them, hey, you're going to get a shot today. And everybody knows universally shot means pain, right?
Hmm.
And so that's what they're expecting. The little ones, they don't really have much of a defense. We kind of lay them on the table
Oblivious.
and, they just get it, they take it and they move on. So my kindergartners, we try to just make it a brave time.
Hmm.
And, if there's tears, there's tears. We try to hand out some stickers, some kind of prize
Right.
at the end, to make it a little bit bearable. But we've covered them until they're about 10 or 11.
Right.
So it's worth it.
Okay. Awesome. Speaking of vaccines, it's obviously there's a whole deluge of commentary and conversations around vaccinations. But how do they contribute to a child's overall immunity?
So, the way vaccinations work, it stimulates your immune system to recognize and fight pathogens without actually causing the disease, right? So, it
Hmm.
shows your body what the disease looks like, but doesn't actually give you the disease. And so, it builds immunity that way. It's a trainer for your immune system
Hmm.
to kind of recognize and combat whatever specific pathogens. So, if, for instance, your child who has been already vaccinated with chickenpox, um, comes in contact with the varicella virus or whatever, and they may still develop some pox, but it's not
Hmm.
going to be to the extent that they would have if they had not been vaccinated. And I do like to remind parents and others that vaccinations are not a cure,
Hmm.
it's a prevention, right? And so, yes, you had the chickenpox vaccine. That doesn't mean that you won't develop chickenpox. The
Hmm.
goal is that you won't die from chickenpox.
Right.
And I know I like to use chickenpox as an example because people just think very casually about it.
Hmm.
But back in the day, before we had vaccines, kids died from chickenpox,
Hmm.
right? And so don't take lightly chickenpox parties. I know people still have those. But you want to be very mindful and actually very grateful for where science has come
Right.
and how far we've come to really preserve and decrease morbidity and mortality from these very common childhood illnesses.
Oh no, I take chickenpox very seriously because I've not had it. Yeah, see, that's not helpful. That's not helpful. So, obviously the story with chickenpox is the older you are, if you get it, it's a lot more problematic. If y'all could see the look on her face, this is so funny. So yeah, I remember when I told my wife that, she had the exact same reaction. She was like, dude, you're 30. What do you mean you've not had chickenpox? I'm like, the chickenpox party was not a thing that I was involved in. So listen, I don't know what to tell you. So I live in abject fear of
Are you vaccinated?
I am, but at the
Okay.
same time, that was a long time ago.
Yeah, adults. The thing is, for me, adults don't do well with many of the illnesses that
Mm.
children experience. Right?
Uh,
Adults with an air pain, they're like, I need, I'm days off from work. I have a
mhm,
headache. I have a this
mhm.
and of that. You have infants, they probably had a ear infection for like 3, 4 days before you start seeing any
Anything.
signs or symptoms. And, they've been just trudging along in life. So that's really the
Yeah.
reaction. Adults don't really do well with chickenpox. So
Mhm,
I was fortunate to have gotten that in the 6th grade. I will never forget. I stayed home for 5 days from school, the longest and the only time I've ever stayed home from school from being
oh
sick.
boy.
And I have my pox scars to prove it, but I'm grateful that both my children are vaccinated and hopefully they
Fingers
will.
crossed.
But I actually do think my husband's in that same state. And so I remember giving him that same look. I'm like, buddy.
Yeah, I know. It's the same look. And anytime I've told a physician that, they look at me like, you are an insane person. Like, what were your parents doing? But obviously, but this is why the vaccinations are
Mhm.
helpful, because it kind of gives you that protection against it, so that it's not as damaging as it would have been historically.
Yeah, and I think the other part of that is to protect our vulnerable populations, right? And so
Hmm.
we don't start vaccines until they're 2 months. And actually, for the chickenpox vaccines, it's not something we give until babies are 12 months
Right.
old, right? And so when we're giving that older child a vaccination, we're looking to protect the very young babies,
Hmm.
right? Because you come into a pediatrician's office, everybody's all in the waiting room.
Hmm.
And then we're looking to protect the older people. Like you said, you got that vaccine a long time. And imagine
Hmm.
if you were 70 or 80,
Oh no, yeah.
right? That's
This, like I said.
a longer time. And so that's the other end of the spectrum. It's really to protect those that cannot be vaccinated for some reasons, whether it's their age, whether maybe they're going through cancer and they've had
Hmm.
all, they've had significant chemotherapy and their immune system is low. So it's really us doing our part in the community to protect each other.
Yeah, let's just hope it's not chickenpox that takes me out. All right. So speaking of immunity, obviously, we have a campaign that we're in the process of building out in the hospital, talking about food as medicine. Um, so how important is nutrition to a child's immune system, and then what are some nutrition tips to help boost it?
I'm so happy to see Doctors Hospital doing that campaign that food is truly medicine.
Hmm.
It starts at home. It starts at my population, the pediatric population, and starting from when they're starting to taste foods at 6 months. It comes down to a balanced diet.
Hmm.
There's no way around that. A variety of fruits, vegetables, grains, healthy proteins, and healthy fats, right?
Hmm.
Whether you decide to be plant based, keto or that other thing, the different diets is different, but just having a balanced, varied diet is really important. And that's going to be your foundation for good immunity. Of course, you can add things like probiotics. You can find that in yogurt. You can buy it over the counter. Hydration, water
Hmm.
water is key, and I think I said this the last time I was on here, but we have to drink more water, right? My goal, my one of the things I would love to see is that we just tax everything else that's not water.
in,
Bec
in the beverage
in the
department.
beverage
Yeah.
department, absolutely, like, there should be no soda or any juice or anything in schools, there's, like, no room for it, it's just empty calories,
Hmm.
right? And so, just encouraging plenty of water intake, especially with, the sun being the sun,
Hmm.
this summer, and I think, it's not gonna end at the end of August, I think we got a few more months ahead of
Oh yeah.
us.
But
Um
we are universal summer, so.
Exactly. And then last would be just to limit the sugar and processed foods. And that's a tough one. I like to have realistic conversations with my parents because I too go to Super Value and I too go to Fresh Market and see the prices of the fresh stuff and then the processed stuff, right? And what can last a little bit longer on the shelf. Especially during this summertime when
Hmm.
kids have their summer stomach that never ends, right?
Tell me about it.
But as best as possible to limit the sugar, limit the processed food, that really increases inflammation and decreases their overall health. So it's important to kind of watch what we're giving our kids. A lot of times the packages says 100% natural, and then you look and it's the natural stuff is like the end of
Hmm.
the ingredients, right? Um, you know, an actual apple, and some water is better than 100% apple juice,
Right.
right? As a pediatrician, I'll use juice as a treatment, for issues like constipation. But you would never hear me out of my mouth say, "Oh, you need to drink juice,"
Right.
because it's not needed. Water is going to be your best bet.
Listen, I agree with you firmly on that one. It's hard to talk about immunity without talking about like vitamins and supplements, and I know that's a different environment for kids than it would be for adults. So, are there specific vitamins or supplements that are particularly beneficial for school age kids, so primary school, high school, where it's very beneficial for them?
If you go to Lowe's, there's going to be a million choices
Hmm.
for kids' vitamins. And I sometimes just like to stroll the pharmacies and see what's out there, when parents come in and ask for a recommendation. I think you and I probably have grown up on cod liver oil, and our
Hmm.
parents were by that and not the good tasting one. Or
Funny story.
Cerecy, or, something they had you drinking to with the hope and goal of boosting your immunity. Again, I go back to having a balanced diet. If you have a balanced diet, then you don't really need to add anything extra.
Hmm.
But then they're like, "Doc, my son and daughter doesn't eat this and they don't eat that and they're picky eaters and I just
Hmm.
feel like something's missing," right? So what are we essentially missing? Are you missing vitamin C? Try to get them eat some oranges, right?
Right.
Is that in their diet? Vitamin D, we luck out because of the sun, right? You send them to be outside
Yeah.
for a
Let them
few
go run
minutes. Yeah,
outside.
absolutely. But the ones you're thinking about omega 3s for, their brain health, for
Hmm.
probiotics for their gut health. And if you start to list out those things, you could be taking like a bucket full of
If you
vitamins.
right.
I just don't think that's realistic for kids. Usually I would recommend a Flintstone Complete, just the chewable.
Hmm.
And I say stress the chewable and not gummy vitamins. They are awful, awful, awful for your teeth.
Yeah.
Right. And I know kids are like, it tastes like candy. You're a dentist. will greatly appreciate if you didn't take them because, I mean, of course you can go to the dentist, you can get them fixed or whatever, but there's nothing like your original teeth,
Hmm.
right? And unless you are excellent about brushing right away and flossing right after, right? I don't know those people.
Oh yeah, it just leaves
And
so much behind.
so much behind. I mean, so I try to just stick with things that they can easily chew and, maybe rinse with some water afterwards. I'm partial to Flintstone Complete, but there are other great, one
One a day, right?
exactly. Yeah.
Okay. Um, Before we jump off of this topic, I guess circling back to the nutrition, how important is it to, 'cause, parents will always say, my kid is a picky eater. They don't eat this, they don't eat that. How critical is it to get kids exposed to different types of foods early in trying to, prevent the pickiness?
Yeah. So I literally just talked about this yesterday with a breastfeeding talk. And when I came back, I wanted some crab and dough.
Hmm.
And my son was breastfeeding, of course, and they're like, "You can't eat that." Yeah, I can. And I did, right? And so the food that we eat on a regular basis, that's our cuisine. You
Hmm.
eat that, within moderation, etc. But introducing them to that early, that picks up their palate. And a lot of times, you go from that first year of life where you can feed your child and they're happily eating.
Hmm.
And then all of a sudden they realize, wait, I have autonomy. I control my mouth. I
Mm.
don't have to take the food that you're giving me. And so they stop and you're like, do you want this? Do you want that? Will you take
Hmm.
a fry? Because we're afraid, like, oh my gosh, they're going to starve.
Right.
They will not starve to death. I promise you that. I have yet to see a child starve to death because, they refuse all the food. So there's usually something that they like,
Hmm.
right? Whether it's for my son, I could put blueberries with anything. I could serve blueberries with curry. Like
Hmm.
he's going to eat those blueberries. And so whatever that thing is, make sure it's on their plate, but continue to offer them new things,
Right.
right? If you know your kid absolutely won't eat curry chicken and white rice, but they will
Hmm.
eat the white rice, you can put a little bit of the gravy on the side, right? Maybe they may touch it and you can put a little bit of corn, a little bit of this or whatever. It just give them some choices so that you
Hmm.
feel like they got something to eat. Like I said, they will not starve themselves. But other than that, if you decide to become a short order cook for all how many people living in your house, you just really have to just keep offering them new things. I think introducing it early outside of things that can choke them or things that
Right.
with known allergies. I think introducing new foods, varied foods early is very important from an allergen perspective, but as well for them to have a varied diet.
Okay. We're having a great conversation thus far with Dr. Teykia Deveaux. We're going to take a quick break for some words from our sponsors, and we will be right back on the Doctor's Hospital podcast.
Experience the immediate care you deserve at Doctors Hospital Urgent Care. When emergency strikes, trust our expert physicians for fast, quality care. With extended hours and cutting-edge medical technology, we're always ready to serve you. Don't wait or take risks with your health. Visit our urgent care suite at Doctors Hospital West on Blake Road for immediate, trusted, and best care.
Welcome back to the Doctor's Hospital podcast. We are continuing our conversation with Dr. Teykia Deveaux on physical health and safety for our kids as they get ready to go back into school. It's a part of the first actually entry in our back to school series on the podcast. And we started off the conversation talking about immunity. And now I want to move into a discussion around COVID-19 precautions and updates. So it seems now like we're in this pattern of every 6 months or so, we kind of have an uptick in case numbers, things like that. So in some ways, it's kind of like you think like you get lulled into this idea of, oh, there's nothing really to worry about, and then you just have this this uptick in cases. So given that we just recently had one, given that kids are just walking germ carriers and we're getting ready to go back into the school year, what are some of the latest COVID-19 precautions that parents and schools should be aware of? Anything new, anything different? Obviously, we're kind of out of the mask wearing part of it,
Mhm.
but what should kids and parents and schools be aware of?
Yeah, I mean, we're probably all way past COVID-19 fatigue,
Mm.
but I think COVID-19 is definitely here to stay. Like you said, the ebb and flow of spikes, they're seeing more cases
Hmm.
in the hospital, which, that takes up more room. And the fact that you have to do so much gown and masking up really can stretch resources. So it's really, vaccinations are still a tough one for a lot of people with it being a quote unquote new vaccine. I will say, obviously, that there are some scientists that will, dedicate their entire life to one vaccine and developing that and getting that through the process. So we've seen a lot of death, I would say, with
Hmm.
COVID-19, a lot of morbidity, people still recovering with lung issues, haven't really gotten back to their pre-COVID cognitive states.
Hmm.
And so to keep those things in mind, thankfully I deal with a population that's pretty resilient. We've had cases definitely with kids experiencing long COVID,
Hmm.
going on to have, significant COVID issues afterwards. But for the most part, kids have done pretty well. And so we hope that continues to be the trend for when school opens back. Parents can consider, the boosters for the vaccines will still be out. Usually around September, we start pushing those again because they're back in school,
Hmm.
right? And then, it's not required outside of healthcare settings to be masked. But if there's the number's rising, or if there's been exposure, it is definitely something to consider. I
Hmm.
felt like obviously during the pandemic, that was the healthiest I've ever been as a pediatrician because I didn't have any of my patients coughing in my face or anything like that. So we just have to remember to practice good hygiene. Regular hand washing is the name of the day. Nothing beats good soap and water and washing properly for at least 20 seconds. And then you want to think about ventilation in these classrooms as school opens up,
Hmm.
if if there's air conditioning or not, but consider making sure that there's good flow. You will start to notice when there's a breakout of some virus if kids are bringing Kleenex to and they have runny nose, etc. And so good hand hygiene, and then make sure kids that, especially once they're in preschool, should know where to cough. You're either coughing in a tissue or you're coughing in the crooks of your elbow,
Right.
and that's to protect your other friends, right? So when you sneeze, if you were to ever Google or YouTube and you see the actual picture of a sneeze and how far that travels, right? You would not want anybody near you to
Mm-mm.
sneeze again. And so really, really important to teach little children where and how to sneeze properly so that we're not spreading germs unnecessarily.
Yeah. That's the thing, you always know when something is going around in a school because you start hearing, oh, so and so was in school today. And I do find, at least from personal experience, that and from talking with friends who have kids in school, that the schools are doing a fairly robust job of reminding parents, hey, if your kid has any signs or symptoms of anything,
Hmm.
be it a stomach virus, something, respiratory, to remind kids to stay home, parents to keep their kids home, that sort of thing. So I imagine, that'll continue to be a method of communication, and that message will continue to be strong. Like, I don't remember that being so
No.
heavy when I was a kid. At any point, obviously, we're dealing with a post pandemic world,
Yeah.
but it is even in the workplace. All of that is different in terms of, someone comes and they cough twice, you be like, you need to go get tested and go home. But
Yeah.
it's kind of the space that you're in because you are working. I think the critical component is you're working to keep yourself and others safe. And I think that's what it kind of boils down to in terms of managing the hygiene and all those sorts of things.
Yeah, that's what community means, right?
Yeah.
To work together and keep others safe. And so that's really, really important. I'm glad that's the message from the schools, right?
Hmm.
Not perfect attendance, but care and
Oh
good
yeah.
health, right?
Because
So
and I think even that, like, because you take that approach, this idea of, perfect attendance seems to be relatively out of the window because you're more concerned about just keeping your kids and your population of kids as a school,
mhm,
keeping them safe.
absolutely.
What should parents do if they see their child exhibiting symptoms of COVID-19, whether they're in the school environment or not?
Yeah, so absolutely seek professional help,
Hmm.
right? This is definitely the time to see your pediatrician. We're here at doctors, or there's a cadre of other physicians that are available in our community, gratefully and willing to see patients. And I think that's important to just see what's going on. Don't be afraid of the test, right?
Hmm.
If it's COVID-19, it's COVID-19. And
Right.
then we can support your child, we can support the parent and the household, to make sure everybody stays well. It's especially important for patients that may have asthma, right?
Hmm.
Or, other chronic issues. that would make COVID-19 that much more significant to their health. So it's really important, especially during that season, to stay up to date with, necessary boosters and vaccinations, anything that can reduce your chance of getting significantly sick and ultimately being hospitalized. Again, I go back to the point of vaccines being not to not have the disease, but it's that you don't ultimately die from it or, have
Right.
significant long-term effects. Yeah,
It's to reduce the potential impact if you come into contact with it.
correct.
Yeah. Um, it's an interesting space living in in a post-pandemic world. But I do think the idea of just being quick is, I think, where a lot of this starts, is paying very close attention. Like, I know, and even with regards to the testing, so we in our house, in conversations with our kid when she needed to get tested, is, you just getting your nose tickled. And that's become kind of the reference point for
Mhm.
if someone has to get a COVID test. And it really helped to kind of, demystify it, take some of the scariness out of it.
Mhm.
And it made it a little bit easier to go through that process in any time where we've had to get her tested.
Mhm.
So even just that, and kind of, not making it a doom and gloom thing, but
Mhm.
more so just, talking them into it nice and gently, and
Yeah.
helping to guide them through that process.
Yeah.
So, switching gears now, like I said, at the top of the podcast, we did mention that we wanted to circle back to healthy eating habits as our last section of conversation. So we're going to look at, the lunchbox. What are some healthy and easy lunchbox ideas that kids will love?
Well, healthy and kids will love.
Mm,
Sometimes they don't go
that's a
together, right?
that's a Venn diagram.
I think the important thing about school lunches is to have some input from your children, right? If you pack their lunch usually by yourself, it may come back just how you packed it,
Hmm.
right? And one, that's just a waste of your hard-earned dollars, because you maybe cut up apples that they bring back, or you sent a halo orange that's $9.99 a bag now, and you're like, "Why didn't you eat this?" "Well, I don't like oranges this week, it's last week the
And
halo oranges were in, but this
it's
week it's
always this
not."
week and last week.
Right. And so you go back to having something varied, something balanced. You want some lean proteins, incorporate some hearty veggies, right? I like carrots. I like celery, things that won't wilt throughout the day, depending on where their lunch is stored and how their lunch is stored. Um, Nuts can be a little bit tricky in sending that to school because you do have some children with nut allergies and some
Hmm.
schools are nut free. So peanut butter sandwiches become a little bit more of a challenge from that aspect. There are alternatives to that as well, but that's an easy one to do. Veggie sticks, carrots, cucumbers, bell peppers, just tagging it with hummus or
Hmm.
yogurt dip, something like that. The mini quiches are easy. They don't have to be warmed up or used at the
Mm.
microwave. They can fit. I actually like those bento boxes, right?
Hmm.
So it gives kids a little bit of what they want to pick. Even as an adult, sometimes I pack lunch and I'm like, I don't want this for lunch today. I wish I had a little bit choices. So sometimes I pack my own self a bento box.
It's like a
So that
little mini buffet.
exactly, it's what charcuterie boards,
Hmm.
right, have now
Adult
evolved.
Lunchables.
Adults Lunchables, right? So I just think having some selections for the kids, things that are easy. You want to know where your kids' lunch boxes are going to be stored, right? You don't chicken salad would be a good option, but if they store the lunch outside, I don't think that's a great
Mm-mm.
option, right? Or anything with mayonnaise or coleslaw or anything like that that could easily cause them to get sick. But they don't need a ton of food. They need a ton of healthy food, fruits, vegetables. Think about what your children are doing at school. Are they really sitting down and they're going to eat a whole lunch? Or are they saving their stomach? You have to know your child, right? Are they
Hmm.
saving their stomach for after school? But easily accessible, things that are going to not make them feel bad right afterwards. So high sugar, high processed foods are going to
Hmm.
have that brain crash. After lunch is going to be tough for the teacher if you do that. And then obviously, like I said earlier, send lots and lots of water so that they stay hydrated for the kids that are running around the playground. I'm not sure if the high schoolers are running as much as we did when we were in high school, but if they're going to be outside hanging out, whatever, just pushing a lot of water at that point.
Yeah, I know from personal experience that's even like zucchini squash is a good one for snacks.
Mhm.
It's quick and easy. And then like you said, I think the idea is having options for kids, because it'll be one thing today and another thing tomorrow. So that's good. Some very, very good lunchbox ideas. We talk about a balanced diet and how critical that is, but especially in terms of for kids, why is that such a crucial part of their physical and their mental development, having a balanced diet?
So we need those essential nutrients for growth, right? Our kids are in a growing phase. They're going from the babies to the grown adolescents, and to do that, they need good food. And
Hmm.
I'm not talking about good tasting food. Need good nutritious food, food that will fuel their brain development, fuel their concentration, support their overall health, prevent disease. Foods that won't affect their mood significantly and energy, etc. So you want to give them good nutritious food that is less processed, and varied, so that they can have the best possible outcome.
Awesome. And then the last one is, I imagine this is always a tough one for parents. How can a parent or how can parents encourage their children to make healthier food choices? I guess especially more so in the school environment, and that may be a question more for older kids where they may have more autonomy over, like, you go to school with lunch money and you're deciding what you eat in a given day. So especially in that space, how can parents encourage their children to make healthier food choices?
Right. Proper nutrition starts at 6 months, right? When you start introducing those foods early to your babies. It's not one of those situations where you say, do as I say and not as I do. We have to model good, healthy eating. So parents setting the healthy example would be
Hmm.
definitely key. I'm sure my daughter's going to listen to this and call me out on it, but
Oh boy.
I love certain cookies, but I noticed that now she has a little cookie habit. So
Hmm.
for me to break her habit, I'm gonna have to break
Break yours.
mine,
Yep.
right? So they do watch what we're doing. They watch what we're eating,
The
and
dangers of parenting.
exactly. And they follow suit. So that's important. Involve them in the kitchen as much as you possibly can, if you are a big cook or not, right?
Hmm.
I am a simple, there's going to be protein and some vegetables, and that's going to be dinner. You can pick if it's edamame or broccoli or carrots, but that's what's going to happen for dinner that day. So make them a
Hmm.
part of the meal planning. Teach them about the benefits of different foods, like why are you eating carrots and what does sweet peppers do for you, especially in the younger ages where they're very still curious about what's going on
Hmm.
with their body. My older kids are concerned about food because it may affect their skin, it may
Hmm.
affect how muscular they're going to be. It may affect their performance on the track or on the baseball team. So, with changing what I'm relating it to, depending on what age my patient is at, is very important. And then you just have to or offer a variety of healthy options. I think having it prepared already and to go, especially after school, that's the tendency to grab, stop at Burger King, stop at
Hmm.
Kentucky. But if you have, like, something already available, that's healthy, already pre-selected for them, that makes it a little bit more difficult, more easier. And then last but not least is limit the unhealthy snacks. So the snack drawer, I'm sure it's brimming to the top because it's summer and that's easy. But once school start, if we can just kind of rein that back in and just keep that snack drawer really limited, more fruits and vegetables, just limit the junk food. But we have to start with ourselves because we're the ones at the grocery
It's
store.
always that.
It's us as parents, and so, I'm, pediatrician as well, but I'm a mom first, and I recognize the ways that I also need to, follow
Hmm.
my own advice.
Yeah,
Yeah.
I think this is probably going to be a recurring comment on this series of podcasts. But kids will do what they see more so than what you say,
Mhm.
and
Absolutely.
so that's always a thing to remember. I'm glad to some degree my daughter hasn't picked up my ice cream habit, but you know, but it is that though, and it's important because they're especially in the growing and developing, you want to make sure, like you said, as a teenager, you worry about, is this going to cause my skin to break out? If you're an athlete, you worry about, is this going to contribute to me being a better athlete in whatever sport they're taking part in? So it's critical to really think through those things. And I definitely think it's good, just even from a bonding standpoint, to have kids involved in meal preparation, cooking, things like that, because it gives you an opportunity to not just teach them about, whatever nutritious food, but it also gives you an opportunity to spend quality time and bond with the kid.
Mhm.
So there's a double benefit there.
Absolutely, yeah.
So this has been another awesome conversation, Dr. Deveaux. We are happy to have had you on again, taking time out of your busy schedule. So thank you again for joining us.
It's been my pleasure, and I look forward to seeing you again, maybe some time back on the series as we get kids ready back to school here from Doctor's Hospital.
Yes, indeed. And for our listeners, just a quick reminder that we are offering back to school health checks all during the month of August and into September. We have 3 packages available, including full physical examinations, blood work, urinalysis, your Mantu health certificates, and a host of other standard testing for your kids as they get ready to go back into school. So if you want more information for any of these packages, you can WhatsApp us at 427-7749, or you can book online at clinics.doctorshosp.com. And as always, we thank you for listening, and we invite you to like, comment, subscribe, and share. And we will see you back here next week on the Doctor's Hospital podcast.
Are you uninsured and seeking a plan that can give you quality healthcare at discounted rates? Unlock affordable healthcare with Doctor's Hospital's LAMP. Enjoy unlimited primary care visits, exclusive discounts of up to 20%, and complimentary imaging and nutrition services. Visit doctorshosp.com/LAMP to register. Comprehensive, cost-effective wellness starts with LAMP.